pelvic floor therapy, is it for me? I know most of you have had some kind of cancer issue that you are dealing with, and you may ask yourselves, do I need pelvic floor therapy? Is this something that I need at this time, or do I have issues? And hopefully I can answer those questions for you in more detail. Our learning objectives, basically, we just want you to understand a little bit about what pelvic floor therapy is and why and how this pelvic floor therapy can help you improve your function. So what is pelvic floor therapy? First, we need to know where the pelvis is. We want to find out where the organs are and other tissues that are present, and we need to understand how the pelvic floor functions. So first, pelvic organs. As you can see, this is the female, this is the male. We have our organs that lay inside our pelvis, and the muscles, which are right here, are the ones that support all these organs. What I want you to see is that the muscles go from your pubic bone to your tailbone. And so it is attached to your spine as well as to that anterior surface here. And these are your abdominals. And you'll see a better picture in the upcoming slide with that. So once again, here are your pelvic organs. They're encased inside these muscles, which are your pelvic muscles. Here are the female, here are the males. And as you can see in a little bit better picture here, that they are attached to your abdominals as well as to that tailbone into your spine. So these muscles are like a sling, and they support all your organs. Here we have the external pelvic floor muscles. What you need to appreciate are the muscles of the male and the female are identical. As you can see the color coordinated picture, that you can see that the pictures are exactly the same of both the males and the females. These muscles each have their own function of how they're going to allow for closure of our anus, our vagina, or around the penis to allow for better functionality for urination, for defecation, as well as for sexual function. If there's compromise to any of these muscles, they can affect any and all of those functions. What I also would like you to appreciate is that these muscles are attached to bones, and these bones have ligaments. And again, the next slide will give you a clearer picture on that. So in that respect, if these muscles are compromised, they can affect the surrounding tissues and musculature as well. Here we have the pelvic muscles looking down inside. So these are the pelvic muscles that I showed you from the outside a minute ago. These muscles right in here, above them would be where our organs would lie. These muscles through here are your hip muscles. What I'd like you to appreciate here is that you have the attachments of your low back muscles right up in here. You have your hip muscles through here. You have some ligaments and some back ligaments passing through here. And what all this is doing is, if they are ever compromised, the muscles can compromise and give you pain to your back, can give you pain to your hips, can cause you pain to the legs, or compromise some nerves in those areas as well. So we just need to be mindful that our pelvic floor, even though we're talking about urination and defecation as the pelvic floor, it can create issues to all the surrounding tissues, which may affect a lot more than just defecation and urination. So the colon. Some of you have had some colon cancers. And when colon cancers are involved, you may have a portion of your intestines removed, or your colon in that respect. So what can happen is we can have some compromise to our abdominal muscles. So as you can see, our entire colon and our intestines are encased in the abdomen. So if you have compromise or you have surgery to the abdominal area, that can create issues to those tissues. And as you can see, this is your large intestine, which leads down to the pelvic region, and that can be compromised as well. So what does pelvic floor function really entail? So the first thing the pelvic floor does is support. It provides constant support to your bladder, prostate, uterus, and the rectum. The second function that it does is sphincteric. So it closes the anus. It has a closing mechanism to the bladder so that you're not urinating or defecating on yourself. The third thing that it does is it stabilizes. It actually has a correlation with your abdominal muscles. So your abdominal muscles and your pelvic floor muscles must work together. If they're working together, they're creating an optimal support for your organs, as well as your back and surrounding tissues. So it is very important to be able to get good stability, and doing stability exercises are going to help with that. Secondary functions of the pelvic floor are sexual functions, because it does support orgasm and arousal. So if you're having sexual issues, it could be the pelvic floor muscles that may be a contributing factor. And lastly, it's a lymphatic subpump. Many times, some lymph nodes have to be removed during surgery. And in doing that, that can cause things called lymphedema. So if lymphedema occurs, that can cause swelling into that whole pelvic region. So the pelvic floor muscles can act as a subpump as well to help pump some of that fluid out of that pelvis. So let's talk about what happens when the pelvic floor muscles are weak. When the muscles are weak, we can have bladder and/or bowel changes, such as incontinence. We can have inability to hold back gas. We may have some low back pain, hip pain, or even pelvic pain. We may have, for women, pelvic organ prolapse. Issues with urgency and frequency is also a big factor when the muscles are weak, and erectile dysfunction. What can happen when the pelvic floor muscles are tight? Well, when they're tight, we can have a multitude of issues, including abdominal, pelvic, and hip or back pain. Like I mentioned earlier, the attachments of those muscles are right there. And so what can happen is those muscles can be compromised if you're having a compromise around those tissues of the pelvic floor. Penile, scrotal, and testicular pain for the males, urinary and fecal incontinence. You may have retention, constipation, bloating, incomplete bladder emptying of either the bowels or the bladder. You may have pain during sex, pelvic examinations, or tampon use for women. Hesitancy or delayed start of the urine stream is very common when the muscles are tight. You're struggling to get the urine out. Urgency frequency is another very common one that we see. When muscles are tight, they put pressure around the bladder, and that can cause you to have a lot of urge. Painful urination or burning, vulvar itching or burning or pain, as well as erectile dysfunction again. So What cancers can affect pelvic floor muscles? Well, honestly, any cancer can affect the pelvic floor muscles. But more precisely for the pelvic cancers, we have prostate being the most common. Uterine or endometrial cancers for women is the most common. But as you can see, there's a multitude of other cancers that can also affect the pelvic floor, which go from bladder, cervical cancer, ovarian, colorectal, which are several, including anal, rectal, and colon. You have testicular cancers, penile cancers, vaginal, and vulvar cancers. They all can play a role in affecting those muscles. But to be honest, it's not the cancer itself that is creating these issues. It's actually the treatments that are creating the issues. So you have to be mindful of that. So what are some of the treatments that you get that can create these issues? Number one is surgery. So surgery creates scars and adhesions. So that can create tension to the muscles, which then can lead to a lot of these muscles being tight. In that respect, when they are tight and you're not using them appropriately, they eventually can also become weak. So you may have a combination. Scars and adhesions bind to the surrounding tissues and organs, and hence why we again have lack of mobility to those tissues. Once again, causes the tightness. And with lymph node removals, we can have the swelling. Radiation is another treatment that unfortunately can cause a lot of tissue tension. With radiated tissue, it can also cause scars, and it can cause the immobility of that tissue. Hormonal therapy is another one that can have some issues and have some things that can happen to the muscles. So what can happen with hormonal therapy is, for women, it can cause vaginal dryness and lead to pain with intercourse. So we're talking about when you're getting estrogen deprivation or testosterone deprivation so that the cancer doesn't spread. When you're removing the hormones, the estrogen or the testosterone, that can affect the tissue. And when that happens, for women, it can cause the vaginal dryness. For men, it can cause a decreased weakness and erectile dysfunction. So understanding the anatomy is one thing, and understanding how cancer affects your pelvic muscles is yet another. But what is pelvic therapy? We need to understand what that is and what happens. So pelvic physical therapy is no different than any other therapy that you've probably have had in the past. The only difference is the muscles are internal. And due to that fact, you have to understand then that we have to potentially do some internal work. So what does pelvic evaluation would look like? First, we will do an external assessment. We need to look at your range of motion and flexibility and strength. We'll look at your range of motion of your spine, your hips. We want to see your flexibility. We want to take a look at your muscle tone and that surrounding tissue. If there is compromise on those muscles, then we need to address those issues just as much as we need to address the pelvic floor itself. We need to look at your breathing patterns. Breathing is a crucial part of your pelvic floor muscles. If you are not breathing appropriately, you may be compromising your pelvic floor muscles in the respect that you're not able to relax them. So we teach proper breathing techniques called diaphragmatic breathing to help to relax muscles to be able to get them more functional. Abdominals and core awareness. We will look at your core. We want to see if your core is functioning appropriately. Like I said earlier, your abdominal muscles and your pelvic muscles work together. If they're not working together, they're working against each other. And that can cause you some functional deficits, such as leaking, such as urgency and frequency. So we need to look at all of that together in order to be able to address it. And lastly is the pelvic exam. So what the pelvic exam entails is that we do an internal and an external exam. So basically we don't use stirrups, we don't use any devices. What we do is we have you on the table and we assess the external tissue. And then with a glove finger and lubrication, we may enter either orifice, depending on the male or female, and we will be able to assess the internal tissues. Be mindful, though, that we do things with your permission. We will never touch you unless we get your permission first, and you need to be comfortable. Okay, we always educate you on what we're doing, and we try to make you understand the benefits and the reasons why we're doing every step of the way. Again, we are respectful of your privacy and your tolerance to pain. So we will never push you and say, we have to do this. We will always say, can we do this? And we will assess the situation on each session and see whether or not we are able to proceed. Treatments of pelvic floor therapy can include a lot of the ones that I've just mentioned, but postural education. Your posture is another key component of why your pelvic floor muscles may not be functioning appropriately. If you are someone who sits all day or someone who is on your feet all day, postures can change, and perhaps just the mechanics of those postures can create tensions to some of those muscles, and that can be affecting your pelvic floor. So we will assess your posture and make sure that you are using your postural muscles appropriately. We will educate you on bowel and bladder habits and how to perform these habits appropriately and change those behavioral things that may be creating some of these bad habits. As I said earlier, breath training, stretching, whether it's stretching of your external musculature versus internal musculature, pelvic floor muscle down training, which basically means relaxing your muscles, and that can occur through manual stretching, or it can occur through something called biofeedback, which is a device that we can do either an internal electrode or external electrodes to help us determine whether you are relaxing and give you that immediate feedback whether you are relaxing through our computer screen. We will continue doing core and lumbar stability exercises because once again, those are going to be crucial to allowing for both your pelvic muscles as well as your abdominals to support your organs. We will assess body mechanics and making sure that you're utilizing your muscles correctly. This is mostly important with people who have incontinence with lifting or bending or sneezing or coughing. We want to make sure that we're utilizing appropriate muscles when you're doing any kind of lifting, those types of techniques so that you can benefit with that. Manual therapy can include myofascial restriction releases, scar mobility, fibrotic tissue. So we're doing a lot of just soft tissue work. There are other types of techniques or treatments that can be utilized, such as visceral mobilization, dry needling, taping, lymphedema treatments, as well as some dilator work for females who may need some internal stretching and positions for intercourse. And we talk a lot about how we can improve on that as well. So if you're asking, is pelvic therapy for me? The answer to that is if you are experiencing bladder and bowel incontinence, if you have any pelvic, abdominal, low back pain, if you're having any sexual dysfunction or any other pelvic issues since your surgeries, then the answer is yes. Pelvic therapy can be beneficial to you. Who do you go and see in order to get a referral? Well, you can go and see any of your physicians, but more specifically, your oncologist or surgeon. You can go to your internist, gastroenterologist, urologist, urogynecologist, gynecologists, pain specialists, neurologists, or physiatrists. And there's probably a slew of other physicians who you might be seeing that may also be able to refer. Any MD honestly can refer to physical therapy and or pelvic therapy. Okay, so in conclusion, pelvic therapy is going to be a great benefit to anyone, but especially to those who have had cancer treatments. It can be a life-changing event for some who have had severe issues. We can make some gains and be able to get you functionality back. And it would be a big benefit for you to at least try it. We do have multiple locations in the Northwestern system that do pelvic floor therapy. We have about 18 locations in the suburbs that do both male and female pelvic floor therapy. So reach out, give us a call, and see if you want to come to one of our locations. Feel free to give us a call if you have any questions, and one of our therapists can reach out and speak to you if needed.